Let's talk about grinding teeth. It's a problem with adults. I'm sure it's a problem with children, and it creates havoc. Do you have some take on it of how it happens, why it happens, how it can be prevented? What can one do?
Yes. Grinding teeth, in dentistry we call it bruxism. Bruxism comes from it can come from orthodontics, that if your teeth, not from orthodontics, but because your teeth are malaligned, are not matching up right. And so sometimes then when you get orthodontics done, it'll take away the grinding of teeth. But by and large, I can't give you a percentage. If I was going to give you a percentage, I would say 90%, 95%, it may be less than that, is due to stress. Stress, even with children, parents think, why would kids have stress? Well, as you know, Helmut, the kids today, they have a lot more challenges going on than we did when we were kids. And from a different nature, but yeah. So kids do have stress. Stress is unresolved conflict. That can be within the family unit. That can be at school. In my office, when I talk with a parent about bruxism or grinding teeth, I usually suggest, I look in the mouth, I say, I don't see anything dentally that is causing the grinding of teeth, orthodontically. So my next thing is we ought to look at 6 main areas. Does your child, has there been a death in the family the last 6 months? Has there been a move where you've moved from one home to another the last 6 months? Has there been a separation or a divorce? Do you have peer pressure or sibling rivalry going on? If you have one of those 6 main things going on, or a combination, I have kids coming in with 4 or 5 of those things happening. It's no wonder that child's grinding their teeth in the middle of the night. Because parents says, they're not grinding during the day, or sometimes they'll say they're even doing it during the day. I said, but they're doing it at night, and it just drives me crazy. I said, what we want to do is find out why your child is grinding his teeth. So are any of those things going on? And if they are going on, then you want to talk with your child, pray with your child, whatever you're going to do there as far as, so that child will have a better understanding. And some of those things obviously cannot be resolved, like on a divorce or other things going on. But you can at least resolve some of these things, and the child have a better understanding in their mind, whether they're 3 years of age or 10 years of age, and go from there. There are other things also, though, besides those 6. Now, let's say the parent says, no, none of those things are there. My child doesn't have any of those problems. I said, does your child, let's say an 8-year-old, does your child play electronic games before they go to bed at night? Do they get on the computer before they get on bed at night? And they say, yeah, they play, the electronic games. I said, let's put it like this. If you're thinking about bills before you go to bed, finances, what are you thinking about all night long while you're asleep? Bills. And so if your child is playing an electronic game, where they're really into it, no matter how much that child is saying it's relaxing them, it isn't relaxing them. And their mind is still really processing when they hit the deck and try to go to sleep. That's a whole nother subject, sleep deprivation that we see in kids. And a lot of that is the amount of stuff like we're doing here, video or entertainment things, that gets that child's mind going before they go to bed. And we expect them to relax and try to go to sleep, and they can't. So What I tell parents to do is, besides on the area of the first 6 I talked about, finding out, resolve the problem that's going on. For a child that's grinding, take hot bath before they go to bed at night. The last half hour they're up, even if it's triple-digit weather, 103 outside, take a hot bath. That last half hour they're awake. Read them a story, comfort them, get them to thinking along positive things, but get them away from electronics the last 2 hours they're awake, or last hour they're awake. Read a book before they go to bed, something that's going to relax them, not get them hyper. And definitely, another aspect besides that is sugar intake. That for the child that's ADHD or a child that has challenges, other ones are hyperactive, definitely don't want to take heavy sugar intake or a lot of carbohydrates in before they go to bed those last 6 hours. Okay, so like could be from noon on, could be from 6 o'clock on. They're not taking sugar intake, caffeine, and all those things. Once again, hyperactivity.
Yeah. Well, that definitely makes sense, and I have read things like that. And in fact, even today, and my wife, I watch very, very little TV or so, but if I do, or let's just say you watch a movie and then right away hit the sack, the truth is, I'm being aware, I realized that all of a sudden you don't necessarily think about the movie, but there is that type of flow, whatever the movie had, which goes with you, nevertheless. And in long time ago, when I worked and was like at least busy and stressed by the time I got off work, I realized very fast that sitting somewhere and just doing nothing for about an hour, chit-chatting with people after work, and then because I stopped working rather late, I was in the hotel business. So I'd go out there, go to that cafe, maybe have a glass of wine, maybe not, but talk to people and let this rush type of work and thinking of what you do with 50, 60 employees and what's happening, let it get out of the system. And then I was able to sleep at home. And if I went right to bed, tired as I was, I couldn't. So that seems to be what you're explaining here.
Yeah. Yeah, you're very welcome. We run in a society that moves at a fast pace, and then we try to sleep. It's kind of hard.
Right. And on top of
rest is a good thing.
On top of it, many of those games, and even if they're not vicious, but you're very tense. Take a guy who plays bowling or whatever, or just watch people looking at the football, at a football game, how they clinch to their chair in terms of anticipation of that ball going where it's supposed to be going. So obviously that game, whatever you do, eating Pac-Man, doing whatever it is, there's challenge, right? Otherwise you wouldn't play the damn game. And so that goes with it. And that's the last thought. And wonderful. I mean, I think that's very, very important information you gave us here, Dr. Leisle. Thank you very much.
You're very